Chronic kidney disease, or CKD, is a widespread health concern affecting millions globally. This condition, characterized by gradual kidney function decline, often progresses silently, often without noticeable symptoms in its initial stages. As a specialist in internal medicine, I've witnessed firsthand the devastating impact of late-stage CKD, making early detection and management paramount. The kidneys, bean-shaped organs located near the middle back, play a critical role in maintaining overall health. They filter waste products from the blood, regulate blood pressure, and produce essential hormones. When kidneys are damaged, they can't perform these vital functions effectively, leading to a cascade of health problems. CKD is a progressive disease, meaning it worsens over time. In its early stages, individuals may experience minimal or no symptoms. As the disease advances, symptoms become more apparent, potentially including fatigue, swelling in the legs and ankles, changes in urination and loss of appetite. The implications of CKD extend beyond the kidneys themselves. It's a major risk factor for cardiovascular disease, the leading cause of death worldwide. Understanding CKD is not only crucial for nephrologists, but for all physicians, especially those in internal medicine, as it significantly impacts overall patient health and long-term outcomes. Early detection of CKD is crucial for improving patient outcomes and slowing disease progression. Since CKD often remains asymptomatic in its early stages, routine screening is essential, especially for individuals with risk factors such as diabetes, hypertension, family history of kidney disease, or those over the age of 60. Simple blood and urine tests can provide valuable insights into kidney health. A blood test measures glomerular filtration rate, GFR, an estimation of how well the kidneys are filtering waste. Urine tests, on the other hand, detect the presence of albumin, a protein that indicates kidney damage. Early detection allows for timely intervention. Lifestyle modifications, such as dietary adjustments and regular exercise, can significantly impact CKD progression. Medications to control blood pressure and diabetes are also crucial in managing the disease. Early diagnosis empowers individuals to make informed decisions about their health. By understanding their condition and actively participating in their care, patients can improve their quality of life and potentially slow the progression of CKD. Chronic kidney disease is classified into 5 stages based on the severity of kidney damage, primarily determined by the glomerular filtration rate, GFR. Understanding these stages is essential for tailoring treatment plans and predicting long-term outcomes. Stage 1 CKD is characterized by mild kidney damage with a GFR of 90 or above. Patients in this stage may have no noticeable symptoms and are often diagnosed through routine screening. Stage 2 CKD involves a further decline in kidney function with a GFR between 60 and 89. While still considered mild, Stage 2 CKD requires monitoring and management of underlying conditions. Stage 3 CKD marks a significant decline in kidney function, with a GFR between 30 and 59. Patients in this stage may begin to experience symptoms such as fatigue and swelling. Stage 4 CKD, with a GFR between 15 and 29, indicates severe kidney damage, and patients require close monitoring and preparation for dialysis or transplantation. Stage 5 CKD, also known as end-stage renal disease, ESRD, signifies kidney failure. At this stage, the kidneys are no longer able to filter waste and excess fluid from the blood, necessitating dialysis or kidney transplantation for survival. Section 4. Confronting the challenge, managing CKD. Managing CKD is, a multifaceted approach that requires a combination of lifestyle modifications, medications, and close monitoring. The primary goals of CKD management are to slow disease progression, prevent complications, and improve quality of life. Lifestyle changes play a crucial role in managing CKD. Adopting a healthy diet low in sodium, phosphorus, and potassium can help reduce strain on the kidneys. Regular exercise can improve cardiovascular health, which is particularly important for CKD patients who are at increased risk of heart disease. Medications are often prescribed to manage CKD and its associated conditions. Angiotensin-converting enzyme, AC, inhibitors, and angiotensin receptor blockers, ARBs, help lower blood pressure and protect kidney function. Medications to control blood sugar levels are essential for individuals with diabetes, a leading cause of CKD. Regular monitoring of kidney function is essential for effective CKD management. Blood and urine tests are conducted to track GFR, proteinuria, and other markers of kidney health. These tests help healthcare providers assess disease progression and adjust treatment plans as needed. Managing CKD is an ongoing process that requires active participation from both patients and healthcare providers. By working together, individuals with CKD can live longer, healthier lives. Section 5. The shadow of CKD potential complications. Chronic kidney disease casts a long shadow, potentially leading to a range of complications that can significantly impact a patient's health and well-being. Understanding these potential complications is crucial for both healthcare providers and patients in making informed decisions about treatment and lifestyle modifications. One of the most serious complications of CKD is cardiovascular disease. CKD patients are at increased risk for heart attacks, strokes, and heart failure. This heightened risk is attributed to factors such as high blood pressure, elevated cholesterol levels, and vascular damage often associated with CKD. Anemia, a condition characterized by a deficiency of red blood cells, is another common complication of CKD. The kidneys play a vital role in producing erythropoietin, a hormone that stimulates red blood cell production. As kidney function declines, erythropoietin production decreases, leading to anemia. CKD can also lead to bone disorders. The kidneys help convert vitamin D into its active form, which is essential for calcium absorption and bone health. As CKD progresses, vitamin D activation is impaired, increasing the risk of weak and brittle bones. Other potential complications of CKD include nerve damage, fluid buildup in the lungs, pericarditis, inflammation of the sacs surrounding the heart, and gastrointestinal bleeding. Early detection and effective management of CKD are crucial for reducing the risk of these complications. Section 6. A complex interplay comorbidities and CKD. Chronic kidney disease rarely exists in isolation. It often coexists with other chronic conditions, known as comorbidities, creating a complex interplay that can exacerbate both CKD and the coexisting conditions. Managing these comorbidities is essential for improving outcomes for CKD patients. Diabetes and hypertension are two of the most common comorbidities associated with CKD. These conditions can damage blood vessels throughout the body, including those in the kidneys, accelerating CKD progression. Effective management of blood sugar levels and blood pressure is crucial for slowing kidney damage. Cardiovascular disease, including coronary artery disease, heart failure, and peripheral artery disease, frequently coexists with CKD. These conditions share common risk factors, such as high blood pressure and diabetes, further increasing the risk of cardiovascular events in CKD patients. Other comorbidities that can impact CKD include obesity, dyslipidemia, abnormal blood lipid levels, and metabolic syndrome. These conditions can contribute to inflammation, oxidative stress, and insulin resistance, further damaging the kidneys. Managing comorbidities in CKD patients requires a comprehensive approach that addresses both the underlying condition and its impact on kidney health. This may involve lifestyle modifications, medications, and close monitoring by a multidisciplinary healthcare team.